Welcome to today's Chronic Pain Hurts podcast, brought to you by DrJanetAustin.org, serving women affected by chronic pain from chronic diseases. Today we asked Dr. Austin to tell us what she means by the term regular sick.
I have learned over the years that it's difficult for people to identify with a chronic disease where pain and fatigue and loss of function can be an everyday part of your life. And so I have found that whenever I got the flu or had a few stitches or went into the hospital for a procedure, that I would let people know that, I'm not feeling well and what was going on. And then it was unbelievable how many people would come out of the woodwork wanting to, bring you some chicken soup or send you a card or some flowers, or if you have to call them and tell them you're not going to be able to do something because you're having a flare, they simply don't have anything to compare it to. The best I can do is to say that when you're in a severe flare of rheumatoid arthritis, it's like having a toothache, an abscess tooth in every joint in the body, because rheumatoid arthritis doesn't affect one or two joints. It can affect all the joints in the body. What I would do is I had several friends and loved ones, and whenever I was in pain or having a difficult time coping with the rheumatoid arthritis, I would kind of spread the pain around. And instead of calling my grandmother every time, I would wait and maybe call her every fifth time, or the next time my sister. I don't want them to feel like, oh my gosh, here comes Janet arthritis. I think you get to such a almost like being a martyr, I guess, because you want to keep working through it because it's chronic. You feel like there's nothing you can really do, but there's so much you can do. And then invariably my husband will say, Janet, did you take your medicine this morning? And I would often say, I can't remember. Would you go and look on the cabinet and see if I took it? And sure enough, I would say 9 times out of 10 I hadn't taken my medication. When you're in a flare, the most important thing to do is to communicate with your rheumatologist or your physician, because sometimes you need some extra medication to get you through some severe flares, and that is because there's so much inflammation going on. And if you don't get the inflammation down, then what's going to happen with the rheumatoid arthritis is you're going to have permanent damage.
Thanks for listening in today. Please join us on Twitter at #AustinJanet and at DrJanetAustin.org.